families who've had a child go into cardiac arrest or who have lost a child to cardiac arrest. So believe it or not, when we hear of cardiac arrest, we usually think of senior citizens. Usually, at least I did before I got into this industry. And you know, even someone that's 20s or 30s, you're like, oh, heart attack or cardiac arrest. That doesn't happen to younger people. And were you there just with Richard and to meet some of the families and everyone else?
I was, and I'm on the board of Play with Heart, which is the organization in Colorado that does the screening. Okay,
so you know, Play with Heart, along with many other foundations throughout the country, you know, they're doing CPR classes, heart screenings, and defibrillator placement. So a lot of these families who have lost children have started these foundations to raise awareness about cardiac arrest in their community. So that's why we were there. That's where we've met. So our company was started 15 years ago by Lon Rosen. He was a Key Biscayne down in Miami firefighter. That's where we're based, down near Miami. And after starting this about 15 years ago, he resigned from the fire department to concentrate on this full time because he's very passionate. He had a daughter born with a heart defect that he could have lost unless he was medically trained as a paramedic and realized something wasn't right, and they took her to the hospital and she had emergency surgery. So he's extremely passionate, and that, you know, passion is shared amongst our whole staff. So I was asked to come here today to speak about the defibrillator you have on property. First thing we always want to do is activate the 911 system if there is a cardiac emergency. And one thing I wanted to, you know, distinguish right away, when we hear of cardiac arrest, we usually use that term synonymously with a heart attack. Sometimes like, oh, they had a heart attack, or, you know, they went to cardiac. They're not the same thing. A heart attack is a blockage problem where blood is not flowing through due to, you know, blocking of the artery. Cardiac arrest is an electrical problem where there's electrical activity in the heart. It's just no longer functioning. It's not perfusing blood throughout the body. So if someone is in cardiac arrest, we need to treat them immediately, versus a heart attack. You know, they may be experiencing some signs and symptoms. They go to a doctor, and they may, you know, they go into the ER, or if you're having a MI, myocardial infarction right now, or you've had a mild, you know, MI. Whereas cardiac arrest, they are going to be unconscious, and every minute that passes, the chance of survival decreases by 10%. So doing the math, after 10 minutes, if someone's in cardiac arrest, chance of survival is going to be less than 1%, if not treated within 10 minutes. So it's very important of having a defibrillator here, activating the 911 system, and beginning CPR. So any questions or thoughts before we start? Speaking about a little bit more that you had before. No?
Brian. Here's Brian.
Okay.
Yeah, Brian had one.
Oh, I was just wondering, what's the protocol? Because we deal with a lot of students that are going to be wet, so I don't know if this is made for using on patients that...
Fantastic question. Definitely when people go into cardiac arrest, they may begin to perspire more, but also too, out here obviously they are possibly going to be wet. You do want to dry the body as best as possible. The main reason is the pads need to be able to stick and adhere to the body, and if there's a lot of moisture or sweat or water on the body, they may not pass. So you definitely do want to dry the body as best as possible. Other defibrillators, you know, there's a handful of competitors out there. With the Philips, you are going to be able to use on a wet or metal surface. I don't know what type of metal surfaces you may have around here, but if it's a wet surface, obviously if they're laying in a puddle, you would not want them laying in the puddle. So you do want to dry the body as best as possible and try to get them to a dry spot, you know, the best you can. But same thing as time, you don't want to spend 5 minutes doing that.
Yeah, because a lot of these students have like wetsuits on, so I don't know how much we're supposed to be moving them around to get the wetsuit off, because they wouldn't...
There are shears in here, there's scissors.
Oh, okay.
I would recommend cutting it right off. Man or woman, the chest does need to be exposed. So, you know, anything above the waist for sure, if it's easy, just to cut it right off. There's a razor in here in case there's excess chest hair on the victim, but also there's shears right through there you can see. So I would definitely recommend cutting it right off.
What's the youngest student you've had age-wise, would you say?
6.
Okay.
And the defibrillator can be used on a 6-year-old. One thing when treating a pediatric in the AED CPR world, pediatrics less than 8 years old or less than 55 pounds, the placement of the pads is center of the chest, center of the back. Versus an adult, both pads are being placed onto the anterior, upper right, lower left. Any other questions on that? No? Okay. The defibrillator you have on property, we spoke about it, is always right up here. We've also maybe spoke about putting some signage, but everyone that's here is pretty much usually who's here on the, there's not, okay, so if any other new folks come on, I would definitely recommend, taking them through the video and also, making them aware of the defibrillator and its purpose and when it may be needed, but it is going to be up here, in this case right here, and I believe it's going to be right down here. So in case of emergency, obviously call 911, tell someone to grab and retrieve that defibrillator as fast as possible, and you want to start your compressions. So when you talk about compressions, everyone has taken the CPR class where you're putting the heel of your palm into the center of the chest. With an adult, they say you're supposed to be able to compress the chest 2 inches. So you think about it a lot, and you may hear people say, oh, bones may break, and if you're not breaking bones, you're not doing properly. That is true. Bones, you may hear a bone break, but if someone is in cardiac arrest, a small fracture is worth saving their life. Essentially what you're doing during those compressions is circulating the oxygenated blood. And if you've taken a class recently, in the CPR class they probably touched on, where in the past you always learned about giving breaths and giving mouth to mouth, they're talking now more for the lay rescue, they're teaching just a compression only. So hard and fast, center of the chest. They always use the song Staying Alive in the classes nowadays, because that song Staying Alive back from the 70s, maybe, is 100 beats per minute. And that's the rate, about 100 to 120 beats per minute, or compressions per minute, is the rate at which you should be giving those compressions. Okay? So your defibrillator's right here, and I'm going to do a demo here, one very similar. It's the same manufacturer. But real simple, there's an on or off button. If you push that on button, you're going to follow and do what it tells you to do. One thing as well, there's a set of pads right here. You would just rip them open, and there's a plug, and they plug right into the top left-hand corner. So make sure you do that. Once you open them, plug them in. Very simple. Just push the on-off button and follow the prompts, and it'll tell you exactly what needs to be done. And if it's adult, we spoke about before, and I'll take you through a demo with this one so you can hear how a defibrillator speaks and see the verbal, visual prompts. But top right, lower left, and as I said before, with the pediatric, less than 8 years old or less than 55 pounds, center of the chest, center of the back. If you have a pediatric that's 6 years old, you mentioned a 6-year-old here, that's 70 pounds, or you'd estimate probably more than 55 pounds, use the adult pads. And, then you would treat them as an adult, top right, lower left. You wouldn't treat them as a pediatric with center chest, center back. Okay? Okay, I'm going to turn this one on. Like I said, the visuals and verbals are very similar amongst all Philips defibrillators, so you should kind of get the gist of how it does work. Who's had an AED training in the CPR class you took? Did they cover AED as well? Okay. Good thing about this one, I can take a set of training pads and plug them in.
Insert adult training pads.
So 2 ways to turn it on. This one has, instead of just the on or off button, this has the on or off button, or a handle that says pull. So I'm going to push the on or off button, and I'm going to follow and do what it tells me to do.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Gives you about 10 seconds to do this. This is with that wetsuit, or if they have shirt, whatever needs to be cut off, you would remove that.
When patient's chest is bare, remove protected. Look carefully at the
pads
pictures
you're going to plug
on
in
the
here.
white adhesive pads.
You're going to have your
Peel
pads.
one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. No one should touch the patient. Analyzing.
Within 10 seconds, the device will determine if a shock is needed.
No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
So this is set at 100 compressions per minute. And if you can get a song Staying Alive, that's approximately the same as that song right here. So it's going to do 30 compressions. This is programmed to do 30 compressions, 2 rescue breaths. But like I said, if you've been trained in just compression only,
Pinch
just
nose,
continue through
tilt
with the
head,
compressions.
and give 2 full breaths. Breathe. Breathe. Continue with compressions.
So it's going to do that for 2 minutes. And like I said, if you've been trained in just the compression only, continue through straight 2 minutes. Don't stop to do the breaths. Continue through straight 2 minutes of compressions. Stop CPR, and it'll analyze again if the subsequent shocks are going to be needed. Second shock may be needed. Now, a couple thoughts you may be thinking. Well, how do I know if someone's in cardiac arrest? Okay. There's plenty of times where people have a heart condition and they may be more susceptible to going into cardiac arrest. You've heard of folks getting an ICD, an implantable defibrillator, that kind of prepares their body to treat themselves without a portable defibrillator being available. Other times, there's people that are undiagnosed with heart conditions. Many of the children that you've heard, horror stories about, there was never any issue with that child's health or energy level, and the first symptom was going into cardiac arrest. So we don't, necessarily always identify. There's still reasons they don't know why the child goes into cardiac arrest. But you're not going to hurt someone with this. If someone does go down and you're like, should I get the defibrillator? Get it. You're not going to hurt someone with this. If you put the pads onto the body, if someone's doing compressions and you put the pads on and no shock is advised, it means it did not pick up a shockable rhythm. It's not a fatal rhythm that the heart is in. If they're unconscious, turning blue, they're dead. Their heart is no longer beating. There's electrical activity. I would say if you were to see an ECG when they're in cardiac arrest, there's activity, but it's unorganized, just scattered activity. And that coarse activity will eventually go to fine and then asystole, flatlining. We've seen that in the movies when they're like, oh, the flatlining, and they get the pad. Asystole is not necessarily a shockable rhythm. That's the Hollywood version of treating cardiac arrest. There's epinephrine and other drugs are needed at that point if someone is in cardiac arrest and they've reached asystole, flatlining. So you're not going to hurt someone with this if you put it on. It says no shock advised. It can do CPR, and then 2 minutes later it'll analyze again if a shock is needed. You're not going to hurt someone with it. And to touch on cardiac arrest a little bit further, the most common rhythm is VFib, ventricular fibrillation. If you've heard VFib, VF, ventricular fibrillation, about over 3/4 of the time, I've heard numbers 85, 86% of the time someone's in cardiac arrest, that's the rhythm that they're in. There's other forms of tachycardia as well, where the heart is beating so fast, but there's no activity of pumping blood because of the accelerated heart rate. So more often than not, that would be the fatal rhythm if a doctor were to see an ECG that someone was in. You want to add anything?
No, but that VFib is exactly what this would treat. So would our unit have pretty much the same
It's going to be very, very similar.
The verbiage may be a little bit different. Okay.
Any questions, guys?
We really just today, wanted to raise that awareness, let you know it is here. There's, like we talked about, there may be some more signage going up, or maybe just even a little window decal on the window, letting folks know who come onto property that there is an AED here. You're starting to see defibrillators more and more. If anyone's traveled through Fort Lauderdale Airport, this is the exact color carry case. You'll see it's a different model of Philips, but that's what Fort Lauderdale International has. Miami has a different model of defibrillator. There's about a handful of different ones out there. Palm Beach, Orlando, working your way up through the state. Every airport in the state of Florida is equipped. Public buildings, police departments, you're starting to see more and more law enforcement agencies have defibrillators in their cruisers. Because if they get to a scene 2 minutes before rescue, that 2 minutes, as we spoke about, could be the difference of survival or brain damage, but time is of an essence. Any other questions or comments or anything?
Before you use that, we have to be sure it's heart not beating. All right.
You would check, but at worst case, or I don't want to say worst case, but if you put the pads on, it'll detect if the shock's needed, and then if anything, we can replace the pads. You would replace the pads. If they're breathing normally, and that's one thing too we're going to touch on, there's a difference between breathing and then a term they use, agonal breathing. agonal breathing is like gasping for air. That's not effective breathing. That's not considered breathing. So if they're breathing normally, they're probably not in cardiac arrest. But if it's agonal breathing, where it's a gasping, that's just the body's natural. I don't know how you. That's just the body's natural reflex to it. So, but it's not effective breathing. So if it's that type of breathing, you would put it on. If they're breathing normally, just they fainted, then it wouldn't be a situation to use it. But it's not, and I just want to emphasize that again. It's not going to shock someone. This button, even if you push it, if it's not going to load that capacitor inside to be able to give a shock if it doesn't pick up the fatal rhythm.
If you're not sure, that's the whole beauty of this, is go ahead and grab the AED. We'll replace pads.
Whether it's AFib or VFib.
VFib,
Okay.
AFib, ventricular fibrillation.
It will pick up either one. Is that correct?
Well, AFib wouldn't necessarily be a shockable rhythm.
Okay.
But VFib is the fatal one. Or, like I said, there's other tachycardias. And the algorithms are pretty in depth where it picks up exactly. They've done studies where they've taken cardiologists, they basically put them all into a room, and they've given them all the different readings of ECGs and said, well, would you shock this? Would you not? And they've literally come up with the algorithm where everything is in a curve of if it falls within this range, that's a shockable rhythm. Anything on the outside of that, they determine that's not a shockable rhythm, and it's programmed not to shock that.
So it basically is going to pick up, does this person need this?
Yes.
Or not?
Correct.
Okay.
Right.
So you guys don't need to worry. That's not your decision. It's that machine has already been programmed to do that.
Yeah.
That's the beauty of it.
Thank you.
Thank you.
Anything else?